Apical pulse. First, you have to assess clinical signs of cardiovascular alterations other than pulse rate, rhythm, or volume, factors that may affect the pulse rate. We have to assemble the equipment and supplies. Watch with second-hand or indicator, stethoscope, antiseptic wipes. If using a Doppler ultrasound stethoscope, obtain the transducer probe, stethoscope headset, transmission gel, and tissue. As we start, we have to explain to the client what we are going to do, why it's necessary, and how he can cooperate. We have to observe hand hygiene, or wash your hands, and observe other infectious control procedures. We also have to provide the client's privacy. Position the client in a comfortable sitting position or a supine position. Expose the chest, the area of the chest, over the apex of the heart. Locate the apical pulse. Palpate the angle of Lewis, which is the angle of Lewis is located just below the suprasternal notch. So here is the suprasternal notch, and just below it is the angle of Lewis, where I can feel a hump. So then slide the index finger to the left of the client's sternum and palpate the second intercostal space. Place the middle finger in the third intercostal space and continue to palpate downward until you locate the fifth intercostal space. Then we have to auscultate and count the heartbeats. Before we start counting the heartbeat, let us use the antiseptic wipes to clean the earpieces of the stethoscope and the diaphragm and warm the diaphragm of the stethoscope by holding it in our arm, the palm of our hand, for a moment. Insert the earpieces of the stethoscope into your ears and slightly forward to facilitate the hearing. Tap your finger slightly on the diaphragm to ensure this is the active side of the head, and place the diaphragm of the stethoscope to the apical pulse and listen to the normal S1 and S2 heart sounds. If the rhythm is regular, count the heartbeat for 30 seconds and multiply by 2. If the rhythm is irregular, count the beats for 60 seconds. After counting the heartbeats, consider to assess the rhythm and the strength of the heartbeat. We have to assess the rhythm of the heartbeat by noting the patterns of the intervals between the beats and assess the volume or the strength of the heartbeat and document.